have another guest, also from Denver, professor on regulatory law and public policy in Denver University. He participated in the legislation on regulating marijuana in Colorado, and he was the president of the Business Alliance on Cannabis. We will now have his presentation called Regulation of Cannabis Weakens the Black Market and Strengthens the Economy. We also welcome Professor Robert Thomas Hoban to Costa Rica.
I'm an attorney, and I'm also a professor at the University of Denver. And I teach marijuana-based classes and have for 5 years now. And much to some of the parents' chagrin, I suppose, they come and they talk at an adult level, at a responsible level, about marijuana and marijuana policy. And as an attorney, it's the same practice. It's the same idea. It's the idea that we can talk about this and we can legislate it and we can create rules that give the government responsibility over what we do because we've given them that power. But we do it in a way that gives us freedom and flexibility. You might think, how does somebody become a marijuana lawyer? How does somebody become a cannabis lawyer and a cannabis professor for that matter? And here's how it happened with me. And I won't take it on too much of a detour, but I want to just give you the background because this is an issue that's near and dear to my heart personally. In 2006, my mother was diagnosed with pancreatic cancer. For those of you that know pancreatic cancer, it's effectively a death sentence. It's not a pretty disease. Every morning I'd go by, I'd make sure she got up and got her day going, and one morning I saw her taking one of her narcotics, her Oxycontin pills, and taking it to her mouth. Because she needed to take this pill just to get her day going, just to get started on her day, to feel good about what she was going to do that day. And I saw her lifting the pill to her mouth, and I saw a little bit of drool. Drool came out of my mom's mouth because of this narcotic, because of this pill. Now, this is 2006, 2007, and this is before the dispensaries started to open up. This is before there was really a commercial distribution system. We didn't know a whole lot about all the different things that marijuana could do. But I knew that anything was better than seeing that, right? This addiction, in the purest, most innocent sense, right? It's an addictive substance, these narcotics, and that's ultimately what happened. I didn't know much about the marijuana program in Colorado, but as Charlie indicated, it was passed in 2009, so many years ago, or pardon me, 2000, so many years ago. I started to look into the program, and at that point in time, there were websites. These websites basically were caregiver websites. You could meet somebody, and the things ranged from, hey man, I'll meet you at the 7-Eleven, on one end, and then the other end, I have some oils and some tinctures that I really think would help your mother. Because my mother, she was willing to try, but she was not going to smoke anything. That just wasn't my mom's style. So I needed to figure out other ways. And I sure as heck wasn't going to be the guy with my brother that made up a batch of brownies or cookies or whatever the case might have been and sent my mother to the moon. That wasn't what I was going to do. So I found other people that had done this and had been down this road, and they helped me. As an attorney with a business practice, it was sort of a natural fit, right? I started to meet these folks, and some of them needed help. At the time, there was no state regulation, there was no local regulation, but there was a constitutional provision. It was in our Constitution because the voters put it there. So there wasn't a lot of guidance. Because there was no guidance, it was my job as their lawyer to sort of keep them in a gray area. They weren't going to get arrested, but then other rules started to come into play. Zoning rules. Business licensing rules, all of these other local government, mostly regulatory standards. So that's in effect how I got into the marijuana profession as an attorney with experience, because you might think an attorney who works in the marijuana field needs to be a criminal attorney, but that's not necessarily the case. I don't practice criminal law. People in this industry need people to advise them how to comply with the regulations, how to comply with contracts, how to address banking scenarios, and the like. It's very complex, and these people in the industry, these big risk takers in the US, they deserve recognition, and they deserve counsel. I believe some of this stuff is going to be made available after the conference, so I won't belabor all the details on some of the slides. Here's some of the things I'd like to talk about. I'd like to talk about the idea that there are policy choices amongst marijuana. There's different ways that you can address the issue of medical marijuana. You don't simply have to legalize marijuana outright. There's different steps. We'll talk about that, talk briefly about hemp policy choices. Let's not lose sight of the fact that marijuana, there's marijuana. We all think of marijuana, which is high in THC. It's a psychoactive ingredient. It's what gets you high, right? But there's other aspects of the plant, other chemical components back in 2006, 2007, I knew nothing about. I know there were people out there that did, but I didn't know anything about those chemical components. It's only today that we have marketing and products that address all these different needs, that really we understand what things can help people. Talk briefly about the effectiveness of regulation. As a professor at the University of Denver, I led a research practicum with 16 students in the fall of 2014. We studied, we looked at, is marijuana regulation effective? We looked at the different regulatory models in different states. I'm also working with Uruguay on regulations, so this is something I'm familiar with. We looked at those things, and we looked at some measures to see, is this working? And we'll talk briefly about that. And then we'll talk about the legislative proposal here in Costa Rica. So policy choices. You can decriminalize marijuana, meaning if you're caught with marijuana, if it's not simply legal, you just can't get arrested, or it's simply a fine. That seems to be a significant trend, particularly in conservative jurisdictions in the U.S. and around the world. It's a decriminalization issue. You're not going to get arrested. It's not that significant of a crime. Medical use. Charlie talked about differences, and obviously Colorado has a medical use regulatory structure. There's medical use structures around the world and around the country. Now, the thing about the medical use is that there's different variations to that. If you look at some states where they allow cannabidiol or CBD only, CBD is the non-psychoactive ingredient in marijuana, which does have medicinal benefit. Some states will legalize that only. Some states will not legalize under a medical regime aspects of the plant that can get you high, some aspects of the plant that you can smoke. So there's different models under the medical use. Then, of course, there's a recreational model, which is what we've got in Colorado, Alaska, Washington, D.C., Oregon, and the like. And then some states like Colorado and Washington and some of the others have medical and recreational use. Hemp policy choices are different. They're a little bit different. Now, it is kind of the same thing. Medical marijuana and hemp are very, very similar in a lot of respects in terms of how they can benefit people. But the other thing about hemp, in the U.S. especially, is that if hemp is lawfully imported, and it's certain parts of the plant, and this is not legal advice, there's a little nuance to it, but there is a legal aspect of hemp products across the U.S. if they're properly imported. So if it's legal and there's not a controlled substance issue, then what have you got? You've got a product that can be shipped across state lines. So then who regulates that? The FDA, the Food and Drug Administration, the FTC, and various other regulatory bodies. So you need to think about, if you take a step in this direction, you really need to think about how and who is going to be responsible for the regulation and understanding the legislation that's proposed here in Costa Rica. Importation and exportation. We talked briefly about importation. Exports are a significant source of revenue for hemp products in Europe and Asia and in Canada. The U.S. is actually exporting some processed oils from hemp plants. We talked briefly about regulatory controls on agriculture. States in the U.S. are developing their own hemp programs. Now, federal law does not allow necessarily for domestically grown hemp in the U.S. That's why you see imported hemp, which is why there's a market for export-import. But there's many states that have these pilot programs, right? These programs where they're testing that hemp products can be grown and produced within a state and regulated. And then there was something called the Farm Bill in 2013. The U.S., the federal government, said that you can pass and grow hemp in different states, so long as it's for research purposes only, which we really, really don't know what that means because it hasn't been defined. But at the end of the day, there are products being domestically produced and put into the marketplace under this pilot program, under these state rules. And again, it differs by country as well in terms of what the rules and regulations are for hemp. So hemp production is a significant policy issue. It has tremendous medicinal benefit, just like the marijuana side of the business or the THC side of the business. But at the end of the day, these are policy choices. I talked briefly about the regulatory study we did in the fall of 2014. And what was interesting, by the way, is that some of my students, when they told their parents or their friends that they were getting involved in this class about marijuana regulation, there was a chuckle, there was a laugh about it, because what are you going to go in and talk about marijuana? But when you start to think about it, it's a product like any other product, but this one's so significant and unique because of the politics behind it worldwide, nationally in terms of prohibition. But also, if you think about the aspects that this is a medicinally beneficial plant. This is not just a plant that can give you a good time, although a lot of folks think it could. And frankly, with generations, it's been beaten into folks' heads that this is such a terribly, terribly dangerous plant. And I don't mean to minimize the impact of marijuana. It's a powerful drug. The THC certainly is. But it certainly doesn't appear to rise to the level of some of the governmental policies that we've seen over the last 70 and 80 years. Colorado. Charlie's from Colorado. I'm from Colorado. A lot of folks in the room are. You're going to hear from a lot of us. We don't necessarily think we're the center of the world when it comes to marijuana. But from a regulatory perspective, Colorado was the first state, first government in the world to regulate marijuana from the top down, meaning it had a state system. California has had medical marijuana for a number of years, and it's a tremendously huge state, and it's a big business there. But they don't have this top-down model. And what I was out to prove when I started this research practicum is that research, or regulation rather, works. And we think it does, based on these objective factors. One other note is in Colorado and in many states across the US, we have what's called a dual regulatory or a dual licensing system. What does that mean? That means you've got regulation at the state level or the provincial level, then you've got regulation at the lower level. We've also got, of course, our federal regulations, but they don't necessarily mix with the lower two, particularly based on these policy standards. So Denver, for example, worked very hard to consider so many different perspectives, and they passed local legislation. One of the things that Denver's very good at is putting out information that you should know. You should know what the law is. We have a lot of tourists that come to Colorado to use recreational marijuana. These people need to know what the law is about consumption, about just the dangers of eating edibles, for example. We've had some stories in the news where edible products were eaten, and they're extremely powerful if they're not dosed properly, and people have harmed themselves in that scenario. So there are some situations, but Denver does a really good job of getting information, education information out there about its regulatory program, as does the state. So that's an important component. Education, education, education. It's not simply a leap into this great abyss, but rather it's something that really can work and people can understand, and the government assists in that, and we've seen that in Colorado and abroad. So when I did the research practicum, these are the things we looked at. We looked at economic impacts, and all of these bullet points on this list, these were the things we looked at to determine whether marijuana regulation was effective. If you're looking at marijuana regulation, how do you define what's effective regulation? It really depends on who you talk to. For example, I have some government attorney friends, and they say to me, Bob, regulation of marijuana is effective only when there's no more black market. Okay, I can see that perspective. I can't say I agree with it, though. And I'll tell you why. Because the black market is going to continue to exist in everything, and it does. Alcohol has been legal since the repeal of prohibition in the United States for decades and decades. There's still an underground alcohol market in the US in various states. That's black market. There's a black market tobacco market in the US in many states. So I don't think that was the appropriate measure. So what we did is we started to look at these things. Real estate, looking at bullet point number 1, economic impacts. Real estate, tourism, property values, business revenue, tax revenue, jobs, all of these things from marijuana direct businesses and ancillary businesses, businesses that support the marijuana industry, all the numbers are up, up, up. Colorado is the number 3 economic driver or economy in the US by percentage in terms of growth, and has been for a couple years. There's some state level politicians that won't concede that this has any relationship at all to the marijuana industry, but it absolutely does in some capacity. School data. Another interesting thing, we've seen children in schools where in a state where marijuana is recreationally legal, not just medicinally legal, possession numbers are down. Children in schools are not getting in trouble with marijuana at the same rates that they used to. This is counterintuitive, doesn't necessarily make sense, but these are the data, this is the data we're seeing. And frankly, we're seeing that data across state by state and medicinal marijuana states where it's very clear that, that these numbers tend to go down. Public health, we've seen, at least by data provided by Denver Health, that narcotic addiction for pain relief, the numbers tend to be down based on objective factors. Does that mean that people simply aren't treating their pain? Or does that mean they're finding alternative ways to relieve their pain through marijuana or other things? That's kind of a hard question to answer, but I will tell you that those numbers are, in fact, positive as well. Law enforcement numbers. There was a tremendous idea that if medical marijuana were legalized and there were stores, that it would increase the burden on law enforcement. But it's actually done the opposite. Law enforcement has not had to deal with necessarily as many medical marijuana or marijuana offenses. There haven't been robberies and break-ins and the like at these stores, these retail locations. Another thing that's happened with regard to law enforcement is law enforcement has seen that even in cities where they don't legalize it, because in Colorado, different jurisdictions within the state can say, we don't want marijuana. They can ban it. So when they do, there's not an added burden on their law enforcement. So those numbers are promising. There's a lot of research that's being done. Our Department of Public Health and Environment in Colorado has dedicated millions of dollars to studying the efficacy of marijuana and scientific research with really, really high-level scientific people from across the United States. So these are things that are happening. We've got the anti-abuse campaigns. We've got educational campaigns. There are very productive and positive ways that governments are dealing with this particular issue. Consumer modification. That's not the best way to say it, but here's how I know that regulation works. Because you can change the rules. The rules can be amended to address a problem. And Charlie could tell you this too. When we did have a situation where there was an individual who came into Colorado and ate too much of an edible, he jumped off of a balcony. Terrible, terrible situation. The regulators looked at the issue and they said, what's the problem here? They didn't just panic and say, we need to do away with this. How can we tweak the regulations? How can we fix this problem? Well, can we identify the packaging better? Well, sure, we can do that. We can require that. Can we require that the dosages be much smaller, combined with packaging? So the packaging keeps it out of kids' hands, lets you know that on Halloween or one of these holidays, kids aren't just going to eat candy, and it's going to be laced with marijuana. The packaging helps that. The dosages help that, and they have a dosing system now that makes sense. And this is also a really, really good thing for medicinal patients, because what it does is it shows that you can get a consistent and quality product, and you know that 10 milligrams of this or 20 milligrams of this will help you consistently. And that's very important. So for consumer protection issues, Colorado and other states where marijuana and medical marijuana have been legalized, you're able to tweak the regulations. And that doesn't necessarily require an act of the legislature. This is where the state and the governmental agencies can come in and fix it, right? They can fix it. So with that said, regulation, based on our study and our research, does work. Doesn't eliminate the black market, but I will tell you this. There was significant talk when marijuana was going to be passed early on about, well, this is only going to embolden these Mexican cartels that are bringing marijuana into the U.S. This was a discussion over and over and over again. What we've seen in Colorado with legalization of medical marijuana, this was even before recreational marijuana, the cartel numbers for marijuana brought into the state of Colorado are down so significantly that it doesn't necessarily even exist anymore. So to the extent that means that the black market is being eliminated, I think we're seeing something like that. Doesn't mean that those folks aren't up to bigger and badder things, but at the end of the day, regulation seems to squash and quash that particular issue. Hemp has so many uses. Medicinal uses, the CBD aspect, the stalks, the fibers, the hurd, the leaves, the seeds. It's such a beneficial product. And this is a good example of that. And we're seeing that there is a robust, well, let me take it a step back. The United States had a hemp-based economy for decades and decades and decades. And it was in the 30s where we started to produce more because there was actually a tax in the US that said if you own agriculturally zoned land and you did not grow hemp on it, you would be taxed. So what did that mean? It meant that people had to grow hemp, and hemp was so beneficial during war times and just as a general product. So with that said, we had this tremendous hemp-based economy, and then it all went away at the whim of misinformation and political changes. We're coming back. Hemp is going to be a significant product again. Now, there's so many different things that hemp obviously can do, but I want to leave you, and I want to stress this thought. The idea of cannabidiol, CBD, combined with other elements in the marijuana or the hemp plant, it's so powerful, and it doesn't have a psychoactive effect. So hemp and medical marijuana can really, really help people, and it doesn't have to impact their state of mind, their brain development, if it's a child. And it can really help people, let alone develop a bunch of products that are good for the marketplace. Ancillary businesses, think about this. We've got hemp production in Colorado. You've got folks that are making hempcrete. You've got folks that are making plastic bags. You've got so many different things that are happening, and that's creating an economic boom. Not just the farmers, but the processors, the producers, the people that actually bring in the machinery to do the processing, et cetera. Physical or industrial products like hempcrete. I know that we're going to hear about hempcrete this weekend and various things that you can do with hemp, commercial building products. What a great idea. What a great idea. Take all of the chemicals that can actually medicinally benefit a human being out of it and render the byproduct so that it can be used for such products. And then nutritional and medicinal components as well. The Costa Rican proposal, very briefly. It provides for research and development. Its intent is to reduce drug trafficking and create jobs. This legislation will have an economic impact that is hands down significant. And we've seen it state by state, country by country, in folks in places that this is happening. There's some of the elements of what the plants or the seeds must have. It provides for oversight, exportation, particularly of hemp products. Tremendous aspect of this legislation that can't be underestimated, particularly in light of what we've seen in the U.S. with imported and exported products from overseas. Various categories of licensure. Not every producer has to be this grandiose multi-ton producer. This is a good way to break things down and provide various parts of the country what it needs. The prices will be governed by a governmental board. There's a tax on it. 7%. In the US, that's pretty low, but that will generate significant revenue. That's all for now. I know we're going to have a Q&A later. I really appreciate your time and your attention, and thank you.